Diabetes is not something that you need to live with for the rest of your life, nor is it irreversible like you've been led to believe. With the help of these powerful GLP-1 medications paired with key lifestyle interventions, you can literally reverse your diabetes now. Whether or not you actually are able to reverse your diabetes, the promise is it is a progressive disease. And so at the very least, implementing the protocols that we're gonna teach you will prevent this from getting worse in the long term. So my name is Dr. Jones. I own clinics that service across the nation. I work side by side my medical practitioners. We have a pretty cool divide and conquer. They handle the prescriptions and I get to do the lifestyle and intervention coaching. It's been really amazing. You know, weight loss and metabolic health for me, it's such a big deal to me. It's very emotional. You know, I lost 100 pounds almost 20 years ago and I struggled for damn near a decade to actually achieve lasting weight loss myself. Being able to help others the way that we do is just, I'm fortunate enough to say work doesn't feel like work, you know? And I definitely hope you guys get a chance to find a career path that makes you feel the same. This is a big deal. You know, diabetes is a very nasty disease. Diabetes will kill you. You know, we know that. It's chronic, it's devastating, and the complications from it are horrific. But is diabetes the chronic, irreversible disease that many want you to believe? It's a very interesting situation because, you know, many practitioners, they'll tell you straight up, diabetes is a chronic, irreversible disease. Majority probably will still tell you that, even though you can literally go to the diabetes website, American Diabetes Association, and you can see the criteria for diabetes remission. Diabetes reversal, remission, whatever you want to call it, but you will absolutely see. They'll talk about what it is, you know, getting your A1C below 6.4 to pre-diabetes and then below 5.7 so that you're no longer diabetic. Of course, you know, we'll get into this later, but lowering your A1C on medications, that's how you stay alive, okay? You gotta get your blood sugar under control first. Ultimately, remission of diabetes means A1C in a healthy range, blood sugar in a healthy range without medications. Think about that one for a second. Now, the process of getting there and how you do that, we'll get into all the nuts and bolts of all this here in a second, but that's truthfully what we're talking about. Such a controversial and heated debate, just like obesity too as well. Insulin was such a massive and is such a massive industry. It's no wonder, you know, it's no wonder that insulin is the primary treatment to diabetes. When you really get into the science of it and when you really get into the meats and potatoes of what diabetes is, okay, so your blood sugar rises to a range that could ultimately kill you. High blood sugar is bad. Like, we understand that, you understand that, but that's what we've been treating. And that's what the primary focus of conventional medicine is when it comes to diabetes management is blood sugar, blood sugar, blood sugar. We've been so focused, understandably so, of the thing that could ultimately kill you that we lost sight or never really understood that the blood sugar, the thing that kills you, could kill you, is simply a side effect, a consequence of the actual underlying problem. You know, and insulin resistance is definitely the driver. We're talking about a situation of there's no more room to stuff the glucose. There's too much glucose in the body. It doesn't matter where it is in the body. These medications are stuffing glucose into the tissues. When you look at the research and you look at the data behind movements of A1C and actual improvements in cardiovascular risk factors and improvements in health, you don't see as much improvement, if any, in health when A1C lowers, if we're keeping the blood sugar in the body. But when you look at classes of diabetic medications that more focus on actually pushing the glucose out of the body, now all of a sudden, maybe not the most prolific movements in A1C, but we see improvements in cardiovascular complications. We see improvements in health. When we really look at diabetes at its core, it really is an issue of just there's too much glucose and nowhere to put it in the body. And continuing to shove it into the cells, out of the bloodstream, keeps you alive in the short term, but it negates the underlying problem. And unfortunately, because as you'll learn in this video, insulin resistance as a primary driver, utilizing things that increase insulin in almost every case, especially injecting insulin, makes the problem worse. You guys will understand that here shortly. Just the simple fact that, I mean, look, take bariatric patients, for example. The data is very clear after bariatric surgery, full-blown reversal of diabetes for long-term, for years. Of course, we know it's long-term with bariatric surgery, just a high reversal rate of overall weight, fat gain, and eventually metabolic health catches up, but there's really good results. Fundamentally, the fact that we see it happen with bariatric patients immediately, within weeks sometimes, should already challenge the status quo that it can't be beat. But there's many examples like this. Back in the early 1900s, Dr. Jaslin actually looked at decreasing intake of food, going through periods of not eating as much. Thought this was just such a standard solution. It's very simple. This is how you fix diabetes. And then creation of insulin not too long after, and well, you guys can figure out the rest. But there's been an explosion of fasting. There's been an explosion of understanding of maybe there's something to the food that we're eating and the types of foods that we're eating and the impact on our health, and explosion of low carbs and healthier approaches and fasting. This concept that diabetes can't be reversed is just nonsense and not true. Let's dig into this, the progression, the development, what's happening in your body. Insulin resistance, in my opinion, and many others, is the primary problem here when it comes to the progression towards obesity and the progression towards diabetes. Let's take a step back here and just look at a healthy body so that we can better understand this. So in a healthy individual, and in general human function, you eat food, blood sugar rises unless you're eating very specific types of foods like fiber and pure fat. But you eat foods, blood sugar rises, your body produces insulin. The job of insulin is to store and remove from the blood, not just your sugar, but also protein and fat too as well. Insulin is a powerful storage hormone. And so a healthy individual who's very insulin sensitivity is the opposite of insulin resistance. You want insulin sensitivity, which is the same thing as decreasing insulin resistance. And so a healthy person, even if you're eating sugar all the time, which is obviously not a good thing to do, you can control that. You're not necessarily getting fatter immediately or gaining weight right away immediately, because at the end of the day, it comes down to whether or not you're in a caloric surplus or deficit. But a healthy body, your body's working with you. Your body's doing everything it can to control your weight. You don't have that powerful signal all the time, the powerful signal coming from insulin. And look, the cause of insulin resistance, there's many, many causes. Toxicity is a big one. Dysregulated cortisol and constant stress mode for the body, causing cortisol spikes, causing glucose release can also drive it too as well. And probably many other things that we don't fully understand. But one huge component that I think most people would have a hard time saying isn't true is lifestyle. Specifically, when I say lifestyle, we're talking about the things that you're not doing that could be lowering your blood sugar and lowering your insulin levels, and the things that you are doing that you don't need to do that are driving your blood sugar levels up, like eating a ton of carbohydrates, like eating a ton of sugar and processed crap, contributes to driving insulin levels up. And this concept of developing resistance to insulin, your body in pure survival for even animals, I mean, you look at bacteria, for example, when you look at antibiotic resistance, it's a very survival mechanism for any creature, if it can, to develop some sort of resistance in an effort to stay alive. And so we see this in humans with medications, we see this with hormones, and so insulin's no different. When you are insulin resistant, as you develop this, it now takes your body, requires your body to produce more insulin to get the job done. Your body has to do that. Your body is doing everything it can to keep those blood sugars in check, to keep your A1C from moving at all, or very little, keep it within a healthy range. Now, as we start, we're blasting our bodies, lifestyle, potentially other contributing factors, more and more insulin, more and more resistance. More and more resistance, though, means more and more insulin. So you have to understand that insulin resistance, I like to think of it as like you push a boulder down a hill, and that boulder is going to start rolling at whatever speed it starts rolling at. And we have to pretend seconds here represent, let's say, months, if you will. As that boulder moves more and more, the speed, the velocity at which it's moving increases, like it's developing momentum. So the speed per unit of time is increasing, and that boulder gets faster and faster and faster. This is very similar, if we can just apply that ratio of maybe 1 second to 1 month, we might guess. Very similar to the progression of insulin resistance. Look at your standard diabetic, for example, and any of you diabetics watching this right now know this all too well. You first probably didn't think there was any problem in your health because your routine blood markers, doctor said everything looks good. I see that you're on your statin, so your cholesterol's good. I see you're on your blood pressure's good. Uh-oh,
I see your A1C starting to rise, and so, you know, we're going to probably put you on metformin soon, bada bing, bada boom, we'll see you on the next checkup. Well, once that A1C rose, as we talked about, your body has been fighting the insulin resistance for years, up to 3 to 5 years on average, before you even see the A1C move. Because they're not checking a fasted insulin or C-peptide panel, you became pre-diabetic, and then you became diabetic. And then the doctor prescribed you some metformin. First it was a little bit of metformin, and then it was a lot of metformin, and then it was a second medication, probably some sulfonylureas, and then it was some more sulfonylureas, and then maybe they threw in a third medication like a glipizide or maybe a GLP-1, and it continues to progress, and now eventually the doctor says, okay, you need insulin, and you said, okay, took the insulin, and then it was a little bit of insulin, and then it was more insulin, and then it was more insulin, and that's where a lot of individuals are stuck. It's challenging. It is tough when you're in that hole, especially into the insulin-dependent category. But it's not a chronic, irreversible disease. I want to make that known that I personally believe, and I have seen, and we have helped many people get out of this issue. Just to kind of put it in perspective with GLP-1 medications, by the way, because we're big fans of GLP-1s and what they do. GLP-1 medications are instantaneously, meaning relative to the hitting the clinical dose for you and your body, maybe 4 weeks, maybe faster, but they start to make improvements in insulin resistance. They also decrease eating. And we just said earlier, the diabetes really at the end of the day is just an issue of too much glucose. So they do two very powerful things to help an individual get out of that problem. So GLP-1 medications, going back to that boulder rolling down a hill, would be like a very powerful helicopter being able to drop a big giant claw. You guys can visualize one of those big army helicopters, grabs that boulder, picks it up, and is able to pick it up for a certain point, and then it drops it, and now the boulder's rolling again, right? I kind of think of GLP-1 medications like this because they can only improve as much as they possibly can. And for some people's obesity and or diabetes, it's not enough. Who wouldn't want, right, to have the aid of a helicopter stop that boulder? If your job was to somehow stop that boulder, you're going to want the help with the GLP-1 medication. You're going to want that helicopter to drop in and do its thing to give you a fighting chance. And so, big fan of GLP-1s and of course using them properly. I want to share this with you guys so that you can understand a little bit of the whole history of diabetes, because it's pretty wild. We didn't have these massive rates of diabetes and obesity, not anywhere near this extent. It really exploded in the 1970s. As you can see here in this graph, obesity and then diabetes took about 15 or so years later. But these diseases just seem to, out of nowhere, progressed in numbers dramatically, okay? They were slowly getting more severe, a bigger problem for society. But what changed? You know, and I'll tell you, if you ask depending on how old you are, if you ask your parents or your grandparents, what was it like back in the day? Like what was standard diet? And it wasn't so carbohydrate laden. In the 50s, something happened though. And so there were some concerns over increased rates of heart disease, naturally so. And some research was done. And, you know, unfortunately at the time, they pinpointed saturated fat. But from the 50s and 70s, there was this massive debate. Is it saturated fat? Is it cholesterol? What is it? And then finally, after decades of debate, about 20 years or so, in 1977, specifically, the government stepped in and made a decision for all of you guys and said, nope, it's saturated fat. So we need to do something about that. We need to reduce the intake of that. Well, you only got carbohydrates, protein, and fat. So when you reduce your intake of fat, you can only eat so much protein, so you're left with carbohydrates. And boy, oh boy, did the big food and grain companies have instantaneous solutions to take care of our need for a high carbohydrate rich breakfast. And pop, poof, there goes the food pyramid. Good old food pyramid. 60% of your diet should come from whole grains. Oh, you know, and I truthfully believe that this big shift is the reason why you saw, and again, I'll show you guys here, this graph, why you can see these massive increases in the rates of obesity first and then eventually diabetes. We started eating too many carbohydrates. We weren't meant, our bodies couldn't handle constant blasts of sugar, glucose, carbohydrates, which creates these insulin spikes And so the resulting effect was massive widespread insulin resistance. There's so many things that we can look at, like the diet, and I have a whole nother video where I go on and on specifically about insulin resistance, so check that out if you guys want to take a deeper dive on that. But when you look at the diabetic epidemic that we're in, the diabetic situation and how out of control it is, conventional medicine has it wrong. Conventional medicine is pushing this narrative that diabetes is a chronic irreversible disease, and all the best thing we can do to help an individual is continue to treat the glucose and treat the glucose in a manner which is stuffing it into the body. And so you're told by your doctor things like, you're doing great, Mrs. Jones, your A1C is under control. And I think a pat on the back is definitely well deserved for somebody who worked really hard, took the medication seriously, started making some changes, and got their A1C down from an area that would have killed them down to a healthy range. You definitely deserve a pat on your back. That's stage number one. That's the first step. And unfortunately, that's where it ends. If we were really doing better for the person, they wouldn't need to continue to increase doses of medications. They wouldn't need to increase and add separate medications and ultimately become insulin dependent and need more insulin. That's not getting better. That's getting worse. Your health is declining, despite what the doctor is telling you about the A1C being better. So we have to understand the difference between the short-term deleterious effects of elevated blood glucose versus long-term, what direction is my health moving in? And unfortunately, when it comes to diabetes, you're gonna have to take matters into your own hand. You're gonna have to get into communication with your doctor. But before you do that, you need to get honest and straight with yourself about the problem that's in front of you. You can't sit there and just pretend that it's okay to be diabetic. Look, I get it. There are many things and many reasons and many justifiers and blah, 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 blah. Okay, but you're here because you're looking for a solution. And the first step towards a solution is gonna come from you getting real serious with yourself and really prioritizing your health. Because look, at the end of the day, we can continue to make excuses until we're blue in the face. But whatever becomes important enough for you is something that you will prioritize. Now, take that for what it is. I know some of you guys are literally in a situation where you just can't do more, but some of you are not. And so I hope this speaks sense to you guys in whatever category you fall into, because you gotta get honest and straight. You gotta accept responsibility for where you're at, make a decision that moving forward, you're gonna put effort towards this. You're gonna prioritize this. You're gonna sacrifice other things in your life, because it's not just a food thing. It's an overall thing. It's a lifestyle. You got to change your lifestyle, and change is challenging. There's resistance to change, and it takes time to develop the habit to where it becomes smooth and seamless. But I promise you, it'll happen. It'll take time, but it'll happen. And I have some really good mindset videos you guys should check out if you're looking for some more motivation. But what do? You got the mindset. You're ready to go. You're ready to execute and reverse your diabetes. Starting with the more extreme situation, my insulin dependent viewers right now, you are going to have to be working with your physician. Really, truthfully, you should be working with your physician throughout this entire process. You should always consult with your physicians before you make any sort of change, massive or medium. I won't say every change, but some of you guys don't have the luxury because you're in a situation like Kaiser where you barely, or the VA where you barely get to talk to your doctors. So, you gotta use some reason here, but yes, talk to your doctor before making a massive change like this, and communicate your desire to reverse your diabetes. And here's the reality. You would think the response would be positive every time. You think the response would be, that's awesome, Mrs. Jones. Kudos to you for making this change. I wish I could help you more, but here's some websites and here's a good book and blah, 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 blah. And let's finish managing your medications, because truthfully, that's the best they can do. And that's, remember, we're doctors, specifically primary care physicians, are victims of a shitty healthcare system. And they barely have enough time to see their patient and manage their medications, let alone implement strategic health coaching. Insurance companies don't pay for health coaching. So it's very, very rare that they do. And so, yeah, that's the best case your doctor can do. And if you have a doctor like that, freaking awesome. Then this process is going to be easy. You're going to let your doctor know what you're doing. Doctor might have some quick advice here and there that they're going to do, but most important thing they're going to do is monitoring you, doing his labs as often as they can, and making adjustments to your medications. teaching you at the same time, hopefully, on how you can interpret what's going on with your day-to-day medications as they also are seeing the changes that are happening. That would be an amazing, amazing scenario. And a lot of you guys, simply by getting into communication with your doctors, have a physician that would love to see this. I mean, think about it for a second. Your doctors have to deal with the same old crap every single day. People come in, ask for their medications. It's boring. And no wonder these doctors become a little, it's the best way to put it, dry, rough, over it. Think about spending hundreds of thousands of dollars and years of your life to pursue a career where you want to help people. And then you get into real world practice and you realize that you're no different than, well, I'll just leave it at that. Keeping your integrity in means literally putting your own family and financial situations in dire consequences because you have to make ends meet. And so that's not what they tell you in medical school. And I didn't go to medical school. I'm a DC. I've talked about that all the time, but I have many, many friends, many colleagues that went to medical school. And so speaking from their experience, it's a vision that's smashed in practice after however many years it takes them to finally realize that the system is broken and that money, unfortunately, is the primary motive behind what happens and what doesn't happen in the healthcare system. Okay, so what happens if your doctor is not supportive? If your doctor says things like, I don't think this is something you should do, blah, 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 blah. I'm not gonna sit there and tell you to disregard and blow off your doctor. I'm not gonna tell you to find a new doctor per se. Although finding another doctor, if that is an option, if your current doctor is telling you, I will not support this, I will not work with you, flat out, you don't have a choice. So if you are left with that predicament, then you need to find a new doctor. And in that situation though, if you are being met with a situation where your doctor is unwilling to work with you, ask the doctor why. Because look, there's always an individual reason, say per specific health reasons, why they feel that you should not do this. And you need to understand that. And maybe they're right. There's absolutely a chance that they may be right. Now, do I think there's a lot of reasons why an individual should not try to beat their diabetes? I can't think of that many, but I don't know everything. The majority of the situation, the majority of the times, it should be a good thing and it should be a positive thing that an individual, you watching this, wants to beat your diabetes. So ask them, challenge them, talk to them. Here's one scenario that I would say I've seen often. Because you guys, look, I coach people. I'm talking to them every single day. I'm talking to them about their conversations that they're having. And so I've learned so much. And the consensus, the objection from doctors usually boils down to, it's not that they don't want to, it's not that they don't care. It's not that they don't want to see you get better, but their clinical judgment is that you will not be able to do it. And they're not crazy. I think the reality of people trying to beat their diabetes, the majority of people trying to reverse their diabetes or put into remission, they're not going to be successful. Same thing with obesity. This is a tough battle. This is not an easy thing. It's not as simple as saying, I'm ready and I want to do it. That's the first step. That is absolutely the first step. But that is not everything. That's definitely the first step. Kind of like an alcoholic, right? Like, what is the first step towards beating alcoholism? Well, it's accepting that you're an alcoholic, right? And observing that and then saying, I want to beat this, right? It's a problem that I want to beat. That's step number one. Same thing here with this, but then, okay, great. Let's get past that. You want to beat it. How the hell do you do that? Going back to the doctors, that's where I think most of the reluctance comes from. They don't want to see you go through a process that could hurt yourself, that could jeopardize your health for something that seems futile. Practice of medicine, doing the best that you can with the least amount of risk. So what's the upside? What's the potential downside? And you absolutely, especially if you're on insulin, can cause some real problems, possibly even kill yourself if you don't know what you're doing because of the things that it takes to actually beat diabetes, which we're literally about to get into here. So outside of that, your doctor can't give you an actual reason. They don't think it's a good idea. You find another doctor, blah, 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 blah. Now, let's say if you do find a doctor that's willing to work with you, great. Let's say you don't have that luxury. Let's say you are stuck with the doctor who is just fighting you, they won't support you. Well, first of all, a doctor cannot abandon a patient. That's the thing. There is patient care and there is standards, so they can't abandon you, all right? So if you told your doctor, hey, unless you can give me a legitimate health reason why you don't want me to try to do this, I'm going to do this and I need your support. You have every right to say that. And I think this is a good idea. And this is what I would tell my very loved ones to do if they were actually stuck in a situation like this. Of course, my loved ones, I have plenty of doctors that can just do this sort of thing. But for many of you, that's where you're going to be at. And I think good communication, explaining a plan, like you got to do your own due research. You're going to have to do your own due diligence. Maybe you're going to have to present some solid information to your doctor as to how you actually plan on doing this. And the main thing that you need from your doctor is, like we said earlier, the cooperative doctor can do the blood work, teach you and help you understand how your body's responding to these medications as far as blood sugar, what happens when you fast, what happens when you go keto, how do you respond, what kind of dosing changes and adjustments do you make, because that's what it takes. You need physician oversight and supervision. And so if you're in that situation where you're insulin dependent and cannot find a doctor to work with you, then I just cannot give you advice on what to do at that point. I'm hoping that you can get the medical supervision that you need in order to do this if you are insulin dependent. Once we come out of that bucket of insulin dependent, now we're talking about 2 medications, 1 medications. I think the risk drops, and not saying anybody should consider doing this without their physician support, but I do think that you're probably going to get less resistance from your physicians to begin with. And so ultimately, getting that support in one way, shape, or form is definitely something that you should absolutely do. Now, look, quick side note, if you are in a situation where you can't get doctor support, I promise you, if you pay out of pocket, you will find a doctor that will support you. So maybe you need to buy some single visits with the physician's time out of pocket that will be willing to do this with you. You're gonna have to do your own research in terms of where you can do this. If you guys happen to be near Dr. Jason Fung's clinic, I couldn't, there is no other clinic that I would refer anybody to that wants to work with under medical supervision to handle and reverse their diabetes. So what do? I've alluded a little bit to what needs to be done. We fast and we reduce our carbohydrate intake. It literally comes down to this. What are the 2 most powerful ways to reduce carbohydrate load? Ketogenic diet, by definition, is the absence of carbohydrates. So if you're following a keto diet, a low carb diet, and replacing it with healthy fats, then you are going to, in effect, lower your insulin levels. And this is well documented. And if you want to go even stronger than that, you go through periods where you just don't eat at all, where you restrict your eating completely. And we call that fasting. And what we have done very successfully for both diabetics and obese patients is we implement the FLOA protocol, FLOA, fasting like our ancestors. With FLOA, what I did is I created structure where structure was missing in the world of prolonged fasting. And we help our patients through the helps of various appetite suppressants like semaglutide, tirzepatide, retatrutide, all these GLP-1 medications. And we stack it with some powerful fat mobilizing peptides like AOD 9604 or some of these growth hormone secretagogue peptides. So we pair those together and we implement targeted lifestyle interventions. We start them off with some intermittent fasting and then help them move up to longer rounds of fasting. This is very, very powerful. And we've had a tremendous amount of success doing this. And when we're not fasting, this is where we go on this low carb approach. And the types of foods that we're choosing, we do want to reduce our consumption of processed foods. I call it the anti-processed food diet. Think paleo, you think Mediterranean. These are great examples to look at. And just go for a low carb version, go for a low carb approach towards these diets if you need structure. And that's it, guys. Of course, we can go on and on. Weight training, fixing your hormones, reducing your inflammation, handling your stress, optimizing your sleep, mindset training. And these are all very, very important. Being aware of cortisol and what to do with it, which kind of goes tied with the stress and sleep. And I have plenty of other videos where you guys can check out talking about these things. Just the keto and the fasting, even if that's all you did. The bar is raised, if you can tell. I have high standards for you. You deserve this. You can accomplish this. And I believe in your potential, even if you don't. But at the same time, though, I also think it's very, very important that we get wins. And a win is completely relative. I've had people who just for the first couple weeks, they went for a walk after dinner. And that's all they did. Because we took an individual who just, no matter what we tried, even when they were on GLP-1s, it was a struggle. We moved them through slower, increasing wins. So for a couple weeks, just going on a 15-minute walk after dinner. And then we slowly started increasing the duration. Then we slowly started increasing the intensity. Then we slowly introduced resistance training. One by one by one, the dominoes start to fall, the momentum builds up, the health improves, and now you at some point click and things change. The space around you shifts because you're focused, you're dialed in, you're getting results. This is, by the way, dopamine. You know, dopamine is that motivation-based, accomplishing your goals type brain chemical, neurotransmitter, which, by the way, long fasting also improves dopamine sensitivity, which is awesome because being able to have motivation, the brain chemical pathways optimized, means that you're gonna have more motivation to accomplish the things that you want to accomplish. And I mean, that's the issue, right? Can you imagine if there was just a dial you can crank up that just immediately makes you more motivated? Because you all have those things that you want to do that are important to you. Many, many reasons get in the way as to why you fail to execute on various goals, but there's both physical and mental barriers. Having that motivation intrinsically increase, I think, is very, very important for long-term success. I hope this was helpful, guys. I hope you have more confidence and maybe a little bit more of a plan of attack in terms of how to even approach the topic, feeling confident that you can do this, not accepting the bullshit narrative that diabetes is a chronic irreversible disease, and that you develop some excitement, confidence, and enthusiasm towards your health, and maybe you execute after this. I'll link in the description if you guys want to work with us, and if you want my help to coach you and guide you. My medical practitioners can prescribe the GLP-1s. You're still going to have a relationship with your diabetes provider. We will not manage your diabetes. We will only coach you and guide you and support you to the best of our ability. Keep it safe out there, guys. If you enjoyed this video, I want you to check this video out on insulin resistance. It is a very in-depth dive specifically into insulin resistance, which obviously you can tell heavily ties into your chance of beating diabetes. We'll see you guys later.